Looks like a lot of you have already received a COVID shot, but also a lot of people aren't exactly enthusiastic about it. You're not running to make an appointment. So that's where we're going to begin this morning with President Biden's new goal in the effort to win over doubters and get more Americans vaccinated against COVID-19. As he works to tackle this vexing problem, CBS News reports more than 20 states across the country are not ordering all the available doses allocated to them. At the same time, new research predicts states like Ohio, Oregon, and West Virginia will face an increase in deaths over the next couple of weeks. So Laura Podesta is in New York City. That's where she's joining us now with the very latest on this. Good morning, Laura.
Good morning, Anne-Marie. So President Biden's new goal is by July 4th to have 70% of American adults with at least one shot and 160 million fully vaccinated. Right now, 105 million are.
Hello, passing out COVID-19 vaccination information.
Canvassers with Detroit's health department are going door to door looking to educate people on the COVID-19 vaccines.
Are you interested in being vaccinated?
Yeah.
Awesome.
They'll knock on about 200,000 doors over the next few months as they seek out those who haven't made up their mind.
There's obviously some vaccine hesitancy going on, and when they know the facts, I think it'll help.
At the White House, President Biden laid out a new vaccination plan.
Our goal by July 4th is to have 70% of adult Americans with at least one shot and 160 million Americans fully vaccinated.
Right now, around 106 million Americans are fully vaccinated. The White House says boosting vaccine confidence is one way to hit its target, making these canvassers an essential part of the process.
There's not one kind of strategy that works. You really have to go where people are, talk to them.
The administration also hopes to vaccinate millions of 12 to 15-year-olds as soon as the FDA authorizes it, which is expected as soon as this week.
We just know that there's a ton of anxiety for the parents out there.
This pharmacy in Wisconsin is already booking tentative appointments.
I'm just glad that at this point we have plenty of vaccines.
The White House is working to make it more convenient to get a vaccine, with more walk-in appointments, pop-up clinics, and mobile units. The White House is also changing how it distributes vaccines. If a state doesn't think it's going to be using all of the vaccines it's been allotted, well, those doses will be distributed to other states that have more demand. Anne-Marie.
So other than having canvassers go door to door in communities to address vaccine hesitancy, just how is the Biden administration looking to reach its goal of vaccinating 70% of U.S. adults by the 4th of July?
It's a big goal, and right now more FEMA resources are being allocated to create more pop-up clinics and mobile vaccination sites in order to reach underserved, usually rural communities. We're also seeing the government give incentives and working with grocery store chains. So if someone comes into a store to get a shot, well, they might also get a discount on their food purchase. The government is also going to be coordinating with sports leagues to offer special promotions to vaccinated fans.
Well, we talked about yesterday in New Jersey, you can get a beer for a shot, which I think will motivate a lot of people. What are health experts, though, saying about the decline in vaccine demand? I mean, is there a concern that this is going to impact our goal, which is to, get herd immunity, to reach herd immunity?
There have been several reports and many experts who've come out and said it does not look like we are ever going to reach herd immunity. And the reason for that is because of the number of variants of COVID-19 circulating right now and because of the persistent vaccine hesitancy. However, if we are able to get all or most of vulnerable Americans vaccinated, we should see a return to normalcy. Anne-Marie.
All right, Laura Podesta, thank you so much, Laura.